have been taking up in general medicine. So today's video I'll be mainly discussing about the one of the very important syndromes, that is the Down syndrome, and it is very frequently asked in your pathology, whether it be the oral pathology or in general pathology. So in this video, in short, we will discuss about the important features of Down syndrome and what are the striking features what can be asked in the form of MCQs or multiple choice questions. So students, beginning with the important features of Down syndrome can be firstly subdivided based on the different findings in the different body parts. So firstly, when we look at the head of such a patient, mostly the patients of Down syndrome, they present with a brachycephalic head with a flat occiput, means the head is at the back, the head is flattened and the forehead is little bit bulging or rounded. So it is a brachycephalic head with a flat occiput, and mostly the sutures are what are found in the skull. Often open sutures are there with large anterior fontanelles are there. So large anterior fontanelles are seen in a patient of Down syndrome. So this was about the consideration what is seen with respect to the head. Now we move on to the next feature, that is the eyes. So in eyes, mostly the patients of Down syndrome, they mostly present with upward and outward slanting with thick epicanthal folds. So the epicanthal folds of the eyes, they are thickened, and the eyes what are there, it is upwards and outward slanting of the eyes is seen. Now when we move on to the next feature, that is in the general features, the patients of Down syndrome, how their hands and feet look like. So the hands and feet of patients of Down syndrome, they are mostly, their hands are short and broad, arms are there, and apart from this, the first and the second toes are widely spaced. So this was the third consideration where we have talked about the hands and feet. Moving on to the skin. Now skin of the children is affected with Down syndrome, or the patients of Down syndrome, it is dry, rough, and there is hyperkeratosis. So hyperkeratosis is seen in the children of Down syndrome. Next, when we look at the muscles, how the muscles are there, how their tonicity is there. So muscles are hypotonic and there is hypermobility. So this is can be seen in the patients of Down syndrome. When we look at the IQ of such children, so mostly the patients of Down syndrome, they have a low IQ, that is between 25 to 50, their IQ is ranging. And when we look at the dental considerations, so most importantly, very important, so dental problems what are seen in children affected with Down syndrome is firstly they have a hypoplastic maxilla. So their maxilla is hypoplastic, means there is small maxilla you can find. The tongue becomes enlarged, that is which is also called in medical terminology as macroglossia. So there is an enlarged tongue what is seen. So macroglossia is seen in the oral findings in the dental problems. Next, they have a tendency of class 3 tendency, means the chin is protruding outward and since the maxilla is hypoplastic, so obviously the mandible is of greater size, leading to a class 3 dental tendency, class 3 dental malocclusion. The tongue, the surface of the tongue, it looks like a scrotal tongue or a fissured tongue. So the tongue of such a patient is having folds and creases, and it is scrotal and a fissured tongue you can see. Next, it is the anterior and posterior cross bites can be seen in a patient with Down syndrome. And when we look at the other findings, other dental problems what can be associated, it is in such patients the acute necrotizing ulcerative gingivitis can be seen in patients affected with Down syndrome. Now moving on to the next important consideration, that what about the teeth. So in teeth, the findings what can be seen in the patients of Down syndrome, they can have generalized microdontia, means the size of the teeth can be smaller as compared to the normal size. Next, the teeth can be either conical in shape, and very important, there is delayed eruption of both primary and permanent dentition, and early exfoliation of both primary and permanent dentition can be seen. But in some children, over retained deciduous teeth can be seen in patients who are affected with Down syndrome. Next, very important finding is that there can be pre-pubertal periodontitis. Means the periodontal problems can be there. There is pre-pubertal periodontitis is also seen in patients of Down syndrome. And very important multiple choice questions which can be frequently asked in your NEET PG entrance exam for MDS and everything. So there is decreased incidence of caries, very important in patients of Down syndrome. That dental caries, the incidence of dental caries is decreased. So very important. It is another very important findings what are in teeth. What we can find is that some in patients of Down syndrome, the primary dentition, it can be seen that up till the age of 2 years even no teeth can be visible in the patient's mouth. Means the eruption of the teeth is delayed by at least 2 years of age. The teeth may not erupt into the child, and the complete deciduous dentition cannot be complete until the age of 5 years. So very important. So there is delayed eruption of deciduous teeth. All right. So and there is over retained deciduous teeth. So even there are some children in Down syndrome, it is found that even by the age of 15 years there is not exfoliation of the deciduous teeth. So the deciduous teeth may be retained until the ages of 15 years. So students and viewers, this was a very short discussion where I have given you important features of Down syndrome for your multiple choice questions in the NEET PG entrance exam. Students and viewers, if you like this video, give this video a thumbs up. And those students who are new to my channel and who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.